Why pelvic pain can last years after surgery or infection? Hi, I'm Dr. Behnaz, a pelvic floor specialist. I meet so many people who come to me with a big question. Why do I still have pain years after my C-section, surgery, or infection? Shouldn't I be healed by now? The answer often lies in something you can't see: scar tissue and adhesions. Let's talk about what they are, why they cause pain, and most importantly, what we can do about them. What are adhesions? When your body heals, it builds scar tissue. That's completely normal. But sometimes scar tissue doesn't just stay soft, it forms adhesions, which are like little sticky bands inside your body. Think about two pieces of tape pressed together. Instead of gliding smoothly, they're stuck. Adhesions do the same thing. Instead of your bladder, bowel, and uterus moving freely, they tug and pull on each other. And every time you move, exercise, or even go to the bathroom, that pulling can cause pain. Where do they come from? Adhesions are actually very common. They can form after a pelvic infection like pelvic inflammatory disease, a C-section, hysterectomy, endometriosis surgery, or cyst removal, even appendectomy or abdominal surgery or childbirth trauma. So if you've had any of these experiences and now feel unexplained pelvic pain, adhesions may be part of your story. Why do they hurt? Adhesions act like ropes inside the body. They pull on organs and tissues, make muscles around the pelvis tighten up in protection, irritate nerves like the pudendal nerve, and limit how the bladder and bowel move, which can lead to urgency, constipation, or a feeling of incomplete emptying. Patients often describe it as a deep pulling inside my pelvis. What can help? Here is the good news. Even though adhesions are common, we have tools to help ease the pain. We do a scar release techniques. If you've had a scar from surgery, gently moving the skin, little circles, lifting the skin, or sliding it can help tissues flexible. And we do also hands-on therapy. In therapy, we use gentle techniques called myofascial release to reduce pulling and restore mobility. When muscles guard breathing, retrains them to relax. Place your hands on your belly, inhale so it rises. Picture your pelvic floor softening like a hammock and then exhale gently. You can also do gentle stretches. Simple, safe stretches remind your body it can move again, like cat-cow exercise, figure four stretch, happy baby pose, trunk rotations. The other thing that you should consider is sitting support. If sitting makes things worse, try cushions or wedges and avoid sitting too long without breaks. Adhesions can also tug on nerves. To protect them, use cushions, avoid hard chairs, and practice gentle nerve glides, lying on your back, extending one leg slowly with calm breathing. I often suggest patients create a little flare kit, a cushion, heating pad, a few calming stretches, and breathing. That way, when pain spikes, you know exactly what to do. So let me bring you a real life example. I once had a patient who lived with pain for years after her C-section. She thought it was just part of being a mom. Every time she exercised, she felt a deep pulling inside. Once we worked on a scar, breathing, and stretches, she told me, for the first time, I feel like my body is moving freely again. That pulling is gone. Scar tissue and adhesions are common, but they don't have to control your life. With breathing, scar massage, stretching, posture support, and nerve care, you can reduce pain and move freely again. If this video was helpful, please subscribe, like, and turn on the notification bell so you don't miss future pelvic health videos. Together, we can make pelvic health understandable and practical.